Here are 3 tests to determine if you're more of a hip ER guy or a hip IR guy. The first one, we're going to take the back leg, we're going to lift it off the ground, okay, into 90-degree position. Hip ER, active range, hold it there. How far can you go? Hip IR, active range, without tipping the pelvis. A lot of guys want to tip the pelvis and cheat it. Keep everything flat and go into hip IR and see which one you have more of. The next one is going to be the rotational hinge test. So we're just simply going to go down into this rotational hinge, load into this glute, into this hip. So our hands are up here, we go down. What happens? Does our knee go outside of our hip? Right? If so, we're more of a hip ER guy, most likely. If our knee goes more in and we kind of load this way with the hip outside, more of an IR guy. Right? There is some distinction between pelvic driven and femoral driven IR guys, but for this test, we just can distinguish between IR, ER bias. Last one, we're gonna go down into hip 90-90. This is less of a test and more of a solution, right? So maybe you have limited range at both. Okay, you're gonna keep this knee down and lift this knee up into ER while maintaining trunk stability. And then you're going to lift the back foot off the ground into hip IR. The big thing is you don't really want to cheat it. You can progress it and try to get the trunk more tall, but we're always trying to take any passive range out of it. So assisted, like hands on the ground, not as good as hands off the ground, right? And so that is one way we can really improve our hip ER and IR in a way that is actually applicable to the mound, right? Because we do have to maintain that trunk stability. And the 90-90 puts us in a pretty good spot. Follow for more tips.